this Fireside Chat on practical solutions for inclusive nutrition programs. My name's Carolyn Moore, and I am the Director of Policy and Advocacy for Spoon. And in just a minute, I'll be joined remotely by my colleague, Lorna Mary Namasuswa, who's a Nutrition Technical Officer with Spoon. And Spoon is a global organization that focuses on improving nutrition for children with disabilities. And we do this because we know that while nutrition is one of the most important things for children to grow and thrive, children with disabilities are at very high risk of malnutrition. This is a problem we've known about for a long time. We have the data. Global data show us that children with disabilities are about 3 times as likely to be malnourished. And Spoon recently has had the opportunity to partner with Access to Health Zambia, Korsu Rehab Hospital, to look at this issue in Zambia and Uganda, and again found very high rates. For example, about almost 70% of children with disabilities being stunted in Zambia, and about 16% being wasted in Uganda. And this risk is especially high for children with feeding difficulties. And we know a big part of this is because children with disabilities face very significant barriers to receiving the nutrition support that they need. And this can really rapidly increase in crisis settings when both malnutrition risks and barriers to care can go up very quickly. So we know the problem, and Lorna is here to tell us what are some of the solutions, what's working in her perspective. Unfortunately, the network with Lorna is pretty bad today, so we're switching to our backup plan, and we'll be showing a video that we pre-recorded. So you'll see Lorna speaking, and then you'll also see me on a different day asking her some of the questions. So let's start the video, please.
Okay, welcome, Lorna. Thank you so much for being with us. We'd love to hear, in your experience, what are some of the practical steps we can take to improve nutrition support for children with disabilities?
Thank you, Caroline. In my role, I work with families, health facilities, and policymakers to improve nutrition support for children with disabilities. There are certainly barriers in making inclusive nutrition a reality, including the fact that many of our interventions are not designed to include children with disabilities. Another barrier has been limited early identification of children with disabilities and those with feeding difficulties, along with limited knowledge by health workers to support the children that they receive in such categories. When it comes to communities, we have seen that many of the families having children with disabilities lack community support. The good news is that Spoon has been seeing improvement. Our program data has shown reductions in multiple indicators of malnutrition who are accessing our programs. A few things have really been key for us, and those have been working in partnerships with different developmental partners, but also the government entities such as the Ministry of Health and the Ministry of Gender, Labour and Social Development. This reinforces sustainability when our projects have closed. Another thing that has been really key is building practical support for the health service providers who are going to work with these children, as well as integrating digital health, as you see how it comes in a good way to support the health workers when they are delivering support to the caregivers. As a partner, we work within Uganda's health system to support provision of inclusive nutrition services for children with disabilities. This is through the twin track approach, where we see that the routine services that are provided for all children in Uganda or that all children in the health facilities can be inclusive for also children with disabilities, but also strengthen any linkages to any more intense services that the children with disabilities might particularly need. We work with a range of health facilities, some of which serve refugees and also populations in high food insecurity areas. We work directly with health facilities to make sure that nutrition services are more accessible through training, mentoring, and using our digital support tool, as well as advocacy. Our focus is on building practical skills that health workers can apply immediately within their day-to-day work while interfacing with families of children with disabilities. For example, we teach our health workers to weigh and measure children for whom the traditional techniques might not really work for. If a child comes in and they can straighten their legs, if a child comes in and they have contractures, then there's a tweak that we do so that train them in so they can be able to take the correct measurements for these children. Our training also helps the health workers to assess for feeding difficulties and coach caregivers on how to feed them safely and comfortably to achieve a positive mealtime experience. Things like modifying food textures for children who are having trouble with swallowing, as well as chewing, and then proper positioning go a long way in improving the mealtime experiences for children. Through training and ongoing mentoring, we have seen health workers gain confidence in identifying feeding difficulties, adapting nutrition counseling, and supporting the children who need longer term or more individualized care. So rather than referring families away or turning them away, we've seen providers become more responsive to support these children who come into their care. Our digital support to Count Me In reinforces this learning at the point of care. Health workers use it to guide assessment, feeding recommendations, and caregiver counseling. In advocacy, Spoon has been raising the need for inclusive nutrition at policy and program levels. Using our program data, it has given us a more accurate sense of the issue in Uganda and generating a lot of interest. We've been presenting in different roundtables and nutrition technical working groups and other technical working groups, as well as to other OPDs and other partners. And this is helping us to build the momentum for the interest in disability. Thank you very much.
Thank you so much, Lorna. We can learn so much from your experience. I'd love to hear a little bit more about your experience with ICTs. We know that's a theme for the Zero Project this year. How can information and communication technologies play a role in getting some of the things that you're describing up to scale?
So to translate training into day-to-day practice, Spoon uses Count Me In, a digital application built specifically for low resource health settings. The app is designed for real-world realities, such as it works offline and runs on basic gadgets, such as basic smartphones or tablets, or if one can access a computer, it can work on the computer. Health workers who have gone through the training use Count Me In as a clinical decision support tool to help them put their training into practice. I'll give an example. So let's look at Sarah, a child with disability coming to access services at our facility. When Sarah comes in at the clinic, the app guides the health worker step by step to assess Sarah's nutrition, screen for feeding difficulties, and understand how Sarah is being fed. The step-by-step assessment for nutrition for Sarah's case can highlight any challenges. If Sarah cannot straighten her legs, that means we will not take the height. If Sarah has contractures, that means we shall not take the work. And also screening for feeding difficulties. And these are usually missed by the standard tools that we use for nutrition assessment. So based on the assessment and the information that we have given or input into the app, the health worker then is able to the app is then able to generate for us an individualized care plan. It guides them through counseling, the caregiver, with practical recommendations and makes recommendations for follow-up and referrals. So Count Me In supports the health worker to do an efficient, accurate assessment. So far for the time we have been working with different health facilities and different sites, we have over 1,800 children that we have put into the system, into the Count Me In system, which is a very good number and it gives us very good information altogether. At systems level, Count Me In produces the much needed data on nutrition and feeding difficulties for children with disabilities. So we see that this data is typically missing from the routine health information system. Spoon uses these insights to inform advocacy and system strengthening, supporting the case for adapted tools and guidelines, inclusive indicators, and nutrition services that work for children with disabilities. In this way, Count Me In is not just a service delivery tool. It is a data-driven lever for more inclusive nutrition systems. As we have deployed Count Me In across the health settings in Uganda, we have learned that technology alone does not change practice. Systems and people do. So one of the key lessons is that ICT must be embedded within the existing workflows. Also, training and ongoing mentoring are very essential. We've seen that initial training builds the familiarity of knowledge and information that you're giving to the health workers. But when you keep on doing the mentorships, we have seen that the health workers build confidence, and also it helps them to troubleshoot any challenges and do the problem solving and improve on their problem solving skills while integrating it into the clinical decision making. We have also learned the importance of designing for contextualities. So I earlier mentioned that the app has an offline version. So during our earlier implementation, one of the key things that came out was the connectivity, poor connectivity, internet connectivity around some parts of the country, and the teams then requested for an offline version. And this has been really well used. So when they are in a place where there's no connectivity, they can still work. When they get into the connectivity zone, then they can always just feed their work onto the server. Also, it being simple for them to easily navigate it around, the interfaces being easy and usable by anyone without even much training or support. And also the speed is for them to be able to move. As I said earlier, that there's a heavy workload, so they need to work very fast to be able to finish their lines by the end of that day. So we see that the offline functionality, the simplicity, and the speed are really critical for adoption. We've also seen that success of the ICT tool will also depend on the ownership and buying at the health facility level. So here we have included the hospital administrators, but also the heads of departments, nutrition, to be able to come along in the training, and they understand how this is going to work. They are also the supervisors of Count Me In, while at the facility level. We've also been talking to the district and national level administrators. We've talked to the district health teams, Ministry of Health, the nutrition division, the disability division, and then the division of digital health information. And these help to understand how ICT can improve services and inform decisions. Overall, we've seen that ICT deployment requires not just a good technology, but a right enabling environment. So you have to make sure that the processes, the people, and the policies are all working together. So you have to make sure you bring together the implementing teams and also the policy teams, and then this can support in making sure that the tool that has been developed can do something right for what it was designed for.
What's your call to action? How can we improve inclusion in nutrition programs?
So I think I have just a few things to talk about here. I think for me, mostly programmers should design nutrition programs that are inclusive by default. Inclusion should be a starting point with specific strategies and not just general intention. We've seen that many people come up with projects and they say, we shall support children with disabilities, but they never mention exact objectives and the outcomes that they want to achieve with such children. So we want to see that for each project that is developed, let them be intentional to see that the children with disabilities are actually included. Then frontline workers should be equipped with practical skills and decision support tools to deliver and advocate for inclusive services.
Thank you so much. Thank you to Lorna for your great presentation. And sorry we weren't able to bring you on live, but thanks so much for pre-recording in case this did happen. Thanks so much to our audience here and online. If you want to know more about Spoon, or if I can connect you with Lorna, please find me here. And if you're watching online, just go to spoonfoundation.com and reach out that way and we can connect you to the speaker. Thank you.